I'm talking to Galit. She's head of data science, and she basically is on the pot of gold, all the data, and we want to know how that is being used. Galit, head of data science, what does it mean? What do you do every day here at the Clalit Innovation Center?
So basically we work of using the data that Clalit has. Clalit has a very big data set encompassing all the health information about the patients. And our mission is to take this data and promote health. Now, what does that mean? So we basically do it in two arms. One is products, and the other one is research. So products mean, for example, if we have a model at the physician's desk telling them which of their patients is going to or is likely to deteriorate due to COVID, for example. So that would be a product that is used. And the other one would be research, something that's its end goal is an academic paper, for example, the effectiveness of the Pfizer vaccine against COVID. So that would be one example.
And so let's talk about the first thing, the services and the products you make for the physicians who are at work. First, to make clear in everybody in the Netherlands, I mean, there is lots of providers of healthcare, and they all have their own little systems, but they're all integrated. In the end, everybody has access inside Clalit to all the information, but they are separate, but they're integrated, right?
True. So we have the data from all the different clinics, from the hospitals, from lab results, from procedures, etc. It is all integrated in our data lake.
And everybody has at the point of care has access to all the information. Doesn't matter if it's X-rays or if it's lab results or all kinds of information, and people have access to that information at the point of care.
So that depends on use. So not every point of care has access to everything for what they need. So primary care physicians have their access to certain parts of the data.
Depending on their level of access.
True.
Okay, so then how do you make products out of that? Now we saw this fantastic product on the primary care doctor that he says in the morning, these are the 10 patients, and you have to proactively take them into account. But that is something now which 100 people are using. But there's a lot of other products which have been created over the last period. Can you give some examples?
Yeah, sure. So some of them are much simpler. So, for example, we have an intervention list given each day for the physicians in charge of giving the anti-COVID treatments. So this list basically gives them everyone who's been infected in the last day, prioritized based on their risk. We have a risk model for severe COVID, and it actually prioritized the list based on that. So that's one example. We have other products, for example, in hospitals, showing nurses in different departments in the hospital who was likely to come to be readmitted within 30 days for them to intervene before they even discharged, in order for them to be less likely to be readmitted. And
do you do? I mean, you have algorithms, but also are you also in the process of the machine learning or just a little bit of AI? Is that already at a practical level?
Yeah. So all the examples I just gave actually use models that are machine learning models. So in order to know someone's risk for CVD, for example, then we have a prediction model that's learned all the data we have, all the historic data, and produces those results.
COVID has changed and accelerated quite a bit, huh?
Yeah, it gave us a lot of work to do, and also I think helped people at higher levels in Clalit and in the country in general to understand the benefit that can come from it.
Yeah. What were the most important products? You already said you had a list of patients most at risk. Did that also change already to a change of policy, that you don't try to treat everybody, but that you look more for the vulnerable people, and that you don't close society anymore, so that a couple of months from now, when COVID will hit with a different variant, we will be more intelligent about our approach?
So I would say two things. First, like I said, we use research in order to inform policymakers. Mm-hmm. So we saw it a lot during COVID. They want to know what's going on, what is likely to happen, what are these treatments work, etc. So we give those kind of answers, and I think we saw some change also in who's contacting who. If it was before that we had some brilliant idea of some innovative idea that we really wanted to be implemented, and we suggested it and tried to sell it inside to people in the organization, nowadays following COVID, when they saw the benefit of it, they're coming to us. Yeah, we really need this list, we really want something, or you already have something for the clinics, but we in the hospitals, we want something too. So it goes both ways now.
Yeah. Does it also mean the amount of people working on data has been tripled?
I wish.
You wish. Because you have all this wonderful data, you have this great connection with Harvard, everybody's interested, everybody comes to you. You need more people, you need more work.
Yes, we are growing, and we are hiring new people, not at the rate I would wish, mm-hmm. but we're trying. Yeah.
Okay. Is the whole world of Clalit, is that a one world of data, or do you also have data from the other HMOs in Israel, or are they in competition and they share as little as possible?
They are at competition. I do not get data directly from other HMOs, but the data from hospitals, which are some of them are ours, but some of them are publicly held. Yeah. That data gets to every HMO for their own patients. They get the data from other places. Yeah. But no, there's not much sharing between the HMOs.
Yeah. There's no pre-competitive working together. It's not that all the data scientists from all the HMOs that you would meet weekly and share everything together. It's more everybody does their own thing.
Yeah.
Okay, so Israelis are human, and like this data, there's a limit to what they will share. What's your biggest challenges for the next 6 months?
Well, I think the biggest challenge is to be able to do like a fifth of everything we want to do. Uh-huh. Say we have really a huge list of a wish list mm-hmm. of projects, of research, of things we say that would be amazing to do. We have the data, we have the resources, we would want to do that, but we can't do everything. Yeah,
and you're also in between that data. I mean, everybody wants to work with you. They have to go through you. These 7 people who, and then also much more people working, and so that must be hard. About data, do you sell the data as Clalit to, if companies say, hey, I want these patients with these and these and these and this, can I get 5,000 patients so I can make a better product? Do you then sell it to them, or do you work together? What's your way of working together?
So it's mostly working together. I think it is important to say that we look first and foremost on the impact and how can it help health within Clalit and in general. Mm-hmm. That's the primary goal. And yes, we have different kind of agreements with the industry, but usually they would not be just give me your data and I'll use it. That would usually not be the case. There would be some cooperation. Yeah. Either we do the research or the program and we give it, or we have some kind of sharing of information, or giving some information, but then getting the results or getting to be
The goal is not to make money out of the data. The goal is to improve health and to get higher level of wisdom.
Clalit is a non-for-profit organization, so obviously we need sources of income, but this is not the main goal. So it's done as a collaboration, and there are different types of collaboration.
Yeah. If a Dutch organization, which has all kinds of fantastic ideas and wants to share, how would they approach you and work together with you?
Well, we have an
Because you don't have time. Because you don't have time. You have Harvard on your doorstep. You have everybody coming. Is there a chance that you would work together? Yeah. And is there things you would be interested in yourself?
So definitely, we get a lot of
email.
Yeah, but we're ready and open and really happy to get more, because we're looking for the things that would actually make the impact. So it could be from anywhere in the world, and we welcome it. It could be really in different domains, as long as it has real impact and we can see a way it might be used, then that's a very good thing, and we really encourage you to contact us.
You're open, but you're busy. Thank you very much.
Thank you very much.
Okay.